I think for people with scoliosis, this is one of the most important papers published in recent years. It took over 8 years to complete, and it studied adult patients with scoliosis. So this is an abnormal curvature of the spine. And it asked the question, do patients with scoliosis benefit more from surgery or non-surgical management? So this is an example of someone who was enrolled in the trial. On the left here, you can see the curvature of the spine. It really makes like a backwards S. And then here, after surgery, that S is much more straightened out. You can also see the lateral view showing appropriate curvature of the spine. This paper asked, does a surgery like this do better for the patient than doing non-operative management? Non-operative management included things like physical therapy, joint injections, or maybe even acupuncture. What I really like about this study is that they followed the patients for 8 years. So you're not just looking at the first 1 or 2 years, but you're really looking at the durability of surgery. And here are the results. In these graphs, you can see the difference between people who had surgery in blue and people who had non-operative management in orange. Each of these graphs is measuring something different about a quality of life or disability. And in each of these, the surgery patients did significantly better at 1 year, 5 year, and 8 years. For instance, look at here at B. This is called a disability index score. Let's zoom in and start at the beginning. You can see prior to surgery, both groups had a high amount of disability, but only the surgical group improved after surgery, with the disability score dropping to about 18. And look, that persisted for up to 8 years. Look now further down at scores for back pain and leg pain. Back pain immediately improved in the operative group, as well as leg pain. Overall, this is really powerful data that shows surgery for the right patient with scoliosis can significantly improve their disability and quality of life. And that improvement can last for a long time. So if you know someone with scoliosis, send them this video. They might like to learn about it.